Hi, this is Julia from Massage by Julia, and today's video is called 17 Things That Your Massage Therapist Wants You to Know. Number 1, hygiene is very important. So before you get a massage, take a shower and use your washcloth to scrub your feet and under your arms, and don't forget your navel. Lots of places where dead skin can accumulate and odors and germs, so we appreciate it when you take a shower. And brush your teeth too. Number 2, we don't care if female clients shave their legs or not. I've had so many of my clients apologize for not shaving their legs. We don't notice, we don't care, and men usually don't shave their legs anyway, so it doesn't bother us. Number 3, I'm looking at my list here. Number 3, when we go to your home, the clock starts when we're finished setting up the table. So if you're in the other room on the phone and putting the dogs away or something and busy for 10 or 15 minutes and we're in there waiting, you're just shortchanging yourself and you're getting 10 or 15 minutes, fewer minutes on the table. And please don't just assume that we're going to extend the hour and give you more time and not get paid for it. Sometimes we can't stay over. Sometimes we can, we don't mind, a couple minutes, but sometimes we can't, we have to run to another client's house. So please be respectful of our time. And number 4, if you have a massage therapist coming to your house, please let us know if your doorbell doesn't work. Or better yet, if the doorbell doesn't work, put a sign on the doorbell that says the doorbell doesn't work and to knock instead. Or even better, get your doorbell fixed, because it's kind of a pain for us to stand there with a heavy table over our shoulder and be ringing the doorbell, waiting and waiting, wondering why nobody's coming to the door. Number 5. Don't ask us if we're actually going to bring a massage table and sheets and music to your session at your house. Yes, of course we are going to bring all the supplies necessary for us to do our job. You wouldn't ask a plumber if he actually brings wrenches with him when he comes over. Number 6. Please don't ask a massage therapist if they're going to give you a discount if you schedule more sessions or several sessions in the next month or 2, or if the therapist is coming to your home, can you offer a discount if your husband is going to have a session right after you? That's kind of disrespectful, because we have a lot of hours and years of training. We put a lot of money into our training. We've got a lot of skills. And how does giving you a discount benefit us? And think about it. Does your doctor, chiropractor, acupuncturist, or even a hairstylist or car mechanic offer you a discount if your husband gets a haircut right after you, or goes in to see the doctor more often? Does he give you or she give you a discount if you go in their office more often? No, don't do that. Number 7, when you call a massage therapist or a massage therapy business, note that it is a business. It's a health care provider. So on the phone, please be professional. And when we pick up the phone, we say, for example, I say, "Hello, this is Julia." Please don't say, "Hey, where are you at?" Or, "Hey, you guys still open?" Or what I like to is, "Hi, how are you today?" I immediately think with that one, oh, it's a salesman calling, because salesmen can talk like that sometimes. I'm going to hang up the phone. I don't know who's talking to me. I don't recognize the voice. No, when you call a healthcare provider, be professional and say, hi, my name is John. My name is Sarah. I'm calling to inquire about massage. My chiropractor, my doctor suggested that I get a massage for my shoulder, or I'm having low back issues, or I have cancer and I want a massage, or I'm inquiring about massage for my elderly father. You know, explain in a professional way why you're calling. And next on the list, number 8, I have, some people don't understand that every massage therapist doesn't know every kind of massage. There are over 200 modalities, types of massage out there. And there's no way that every massage therapist knows every single one. We're not interested in studying every single kind of massage, every modality. We haven't taken the time. We don't have the time and money to learn everything. It's like one doctor can't also be, can't be a GP and a dentist and an OBGYN and a surgeon and on and on and on. So we study what we're interested in. So maybe 3, 4, 5 things. Some therapists only do one thing, like pregnancy massage. But look at their website before you call and find out, if you're looking for a deep tissue, for example, find out if it says that on the website. Or call them and ask them, Or if that person doesn't do, let's say, deep tissue, or doesn't work on children, then they can maybe refer you to somebody or refer you to a website with a directory of therapists who do that kind of modality. Number 9. Please use appropriate terminology. We're called massage therapists. We're not the massage lady, and some massage therapists don't like the term masseuse or masseur. Those are more old-fashioned, and some therapists don't like that either. So the correct phrasing is massage therapist. Number 10. Please don't put on any perfumes or colognes or aftershave before your massage. So if I go to your house and you've got all this all over you, I might be allergic to that smell, or not like the smell. It's going to get all over my sheets. If you go to a therapist treatment room, it's going to be kind of a small closed-in room, and your cologne or aftershave might linger in the room. And again, that therapist might be kind of allergic, but also that scent might linger for quite some time, a few hours after, in that little closed-in room, and all these other clients are going to come in after you, and that scent is going to be there and might bother them. And they might, for example, if they're a cancer patient, they might really feel sick if a strange smell is in the room. So no scented lotions and aftershave and cologne and all that kind of thing, just plain. Also related to that, I wrote down that when I go to your home with my table, please don't cook something really stinky right before I arrive. Like, I love the smell of garlic. I love garlic, but not when I'm bringing my massage table in, because the smell of garlic or whatever strong smells literally soaks into the vinyl on my table and gets in my hair, my clothing, and then I'm going to be bringing that to the next person's house. So no sense, no cooking, and you'll be, your therapist will be very happy. Next, number 11 now. Number 11, please don't ask if we have sanitized the table, or if these sheets that we're putting on the table are clean sheets, and have we used them for another client. Are you kidding? Would you ask those questions of any other healthcare provider? Enough said. Okay. Number 12, deeper pressure is not always better. And pain during a massage is never good. okay? If you're being hurt and pummeled on a massage table, speak up. Tell the massage therapist to lighten their pressure. And if they're just wailing on you, you're not seeing a professional. I'm sorry. But definitely speak up. You're supposed to have a conversation before your massage, like on the phone or when you get there. What kind of pressure do you want? And the therapist is also supposed to ask you once or twice when you're on the table, how is the pressure? So speak up. It's your time, it's your money. Also, if you're getting too deep work done, the therapist could be bruising structures and tissues underneath the skin, and they might not even know it. So that's not a good thing. Also, you might just try, if you're used to getting really deep work, maybe try during that same session a few minutes of some lighter modality, like finishing off with a Swedish, for the last 15 minutes, or lymphatic drainage therapy. That's really light. Or craniosacral therapy. That's really light. You can have a full 60 minutes of those lighter modalities, or like I said, just the last few minutes to finish off and just do something different. Try that. And related to this issue, I have met people when I'm out and about and we're talking, and they find out what I do for a living, and they say, oh, I had a massage once years ago and it hurt so bad that I never had another massage. I am just never going to go have another massage. It was awful. And to me, that's like saying that you went and had a bad haircut one time, so you decided to never get your haircut ever again. Again, if something isn't right when you're on the table, if it hurts, speak up and tell your therapist to use lighter pressure. They're not supposed to be hurting you. Okay, let me turn over my list, and we have number 13. Oh, number 13, don't help. So when I'm working on somebody's hands, don't be lifting each finger in turn as I am getting ready to work on each finger. Because every time you're lifting something, you're tightening up all these muscles that I'm trying to relax. And it's really annoying. You're supposed to be not paying attention to what I'm doing. So float away, think about something else. Don't think. Listen to the music. Don't be lifting everything or holding your arm up like a log. Just relax, don't pay attention, don't help me. Okay, thank you, but don't help me. Number 14. It is illegal for us to be in the same room with you when you're undressing and getting on the table, or when you're getting up off the table to get dressed again. So please don't say, oh, it's okay, I don't mind. Yeah, well, we mind, and there is a law. Now, there are exceptions where I have had to assist an elderly person or a cancer patient, getting their clothes on and off or something. That's different. But in general, no. We're going to leave the room, go wash our hands, give you your privacy to take your clothes off, down to your underpants. Then you're going to get on the table under the sheet, and we're going to keep you properly covered the whole time. Number 15, have regular massages. So in our profession, we suggest massage for everybody really every 4 to 6 weeks, and it's called preventive medicine. And it's really going to help your muscles and your tendons and your ligaments stay nice and pliable and healthy. It's going to help your immune system, help decrease your mental stress. Some clients have massage every single week. And just as you eat right, you go to the gym, you work out, getting massage is part of your health care too. It's part of healthy living. So be sure to schedule that in. And related to that issue is don't live with a pain or an injury for 5 months and then have us come to your home and expect us to fix your whole body in 60 minutes. It's easier for us if you don't put off your massages, especially if you are injured. So it's better for you, better for us to have more regular sessions. Number 16, show up to your appointment. So if you're going to see a therapist in their treatment room, they have to put in a lot of preparation to get ready for your appointment. There's just a lot of preparation that goes along to get the room ready. They even might have been out doing errands and have to cut those short to rush back to their treatment room to get ready for you. And if you don't show up, they're sitting there and they're waiting and waiting and waiting and waiting until many minutes go by, until finally they realize that you have stood them up. And that's really disrespectful. So just call and cancel. And then another part of this is, if you don't show up, you have prevented another person from taking that time slot. And somebody might not feel very well and really needed that massage, and you didn't allow them. And also, if the therapist didn't collect your credit card number at the time of booking, he or she has lost that income because you didn't show up. And that's really not very nice, is it? And then lastly, number 17 is really important. It has to be said, please do not ask for a sensual massage or any sex act during your massage or when you're trying to make an appointment. That has nothing to do with massage therapy. Massage is part of healthcare. We are health professionals, just like a physical therapist, an acupuncturist, chiropractor, right? If you want to go see a prostitute, be my guest and go see a prostitute. But don't ever ask of anything like that of a massage therapist. So we have a lot of training, we have a lot of passion for what we do. We like to help you feel healthy and get healthy, and we love having you as clients. So just think about all these things that I've said, and everybody will be happy. Thanks.